Good day, everyone. I am Kylene Polinar from the Group 3, and our case presentation for today is all about hypospadias. Hypospadias is an anatomical congenital malformation of the male external genitalia. It is characterized by abnormal development of the urethral fold and the ventral foreskin of the penis that causes abnormal positioning of the urethral opening. In hypospadias, the external urethral meatus may present various degrees of malpositioning and may be found with associated penile curvature. Depending on the location of the defect, patients may have an additional genitourinary malformation. Hypospadias is common and doesn't cause difficulty in caring for your infant. It is the second most common congenital disorder in males after cryptorchidism, but it is the most common penile congenital malformation. Surgery usually restores the normal appearance of your child's penis. Recent advancements have made it possible for children less than 12 months to undergo a single stage repair with relatively good outcomes. With successful treatment of hypospadias, most males can have normal urination and reproduction. This is a case of a 2-year-old patient who is medically diagnosed having hypospadias at birth. The patient's opening of the urethra is located midway between the edge of the head of the penis and the middle of the side of the penis. Without the money for an earlier surgery, the patient was brought to hospital and is scheduled to a stage 1 correction surgery for distal hypospadias after 2 years and 3 months of birth.
Hello, good day. My name is Wina Mae Paquibot, and I'm going to discuss about our patient's profile. Our patient's name is Prince Arthur Navarro, a 2 years old male, and was born on December 10, 2020. He lives in Giwanan, Mabini, Bohol, and he's a Roman Catholic and a Filipino. His mother's name is Annalie Navarro, a 35 years old and a farm worker. And his father's name is Anthony Navarro, a 38 years old and a forest ranger. The date and time of his admission was on March 12, 2023, and his final diagnosis patient was diagnosed Hypospadias. And about his family history, the patient's mother has diabetes during pregnancy, and the uncle of the patient on his father's side was born with hypospadias. About his past history or medical history, the patient was born low birth weight and born early or preterm. And his present history, on March 12, 2023, at 8:35 p.m., the patient was admitted at Galerius Hospital and was diagnosed of hypospadias. And that's all. Thank you.
Good day, everyone. I am Rodelyn Morales, and today I will discuss the anatomy of urethra or the hypospadias. The urinary system function is to filter blood and create urine as the waste byproduct. The organs of the urinary system includes the kidneys, renal pelvis, ureters, bladders, and urethra. The body takes nutrients from food and converts them to energy. After the body has taken the food components that it needs, waste products are left behind in the bowel and in the blood. The kidney and urinary systems help the body to eliminate liquid waste called urea and to keep chemicals such as potassium and the sodium water in balance. Urea is produced when foods containing protein such as meat, poultry, and certain vegetables are broken down in the body. Urea is carried in the bloodstream to the kidneys, where it's removed along with water and other waste in the form of urine. The urethra is the tube that lets urine leave your bladder and your body. If you were assigned male at birth, your urethra passes through your prostate and into your penis. If you were assigned female at birth, your urethra is much shorter. It runs from your bladder to open in the front of your vagina. At the same time, the brain signals the sphincter's muscles to relax to let urine exit the bladder through the urethra. And there have the function of the urethra. So the function of the urethra is a part of the urinary system. This system is made up of your kidneys, bladders, ureters, and urethra. Your kidneys clean your blood and produce urine, a waste product. From your two kidneys, two ureters have the urine to the bladder where it's stored until you urinate or pee. Urine leaves your body through a hole at the end of your urethra rather. That hole from the inside to the outside is called urethral meatus. The term meatus refers to any opening from the inside to the outside. And lastly, we have the anatomy of the urethra. Urethra is a passageway located in your body's pelvic region. The walls of the tube are thin and made up of epithelial tissue, smooth muscles, cells, and connective tissue. The urethra has two different types of sphincters, or muscles that act as valves that open or close. There is an internal urethral sphincter, which is located at the point where the urethra leaves the bladder. There's also an external urethral sphincter located in the pelvic floor. These muscles work together with the bladder to get urine out of your body. And that's all of my discussion. So, once again, I am Rodelyn Morales. Thank you for your listening.
Good day, everyone. I am Kylene Polinar, and at this juncture, I am going to discuss the pathophysiology of hypospadias. Hypospadias is a birth defect in which the opening of the urethra is on the underside of the penis instead of at the tip. It is commonly seen in males with decreased androgens or with receptors that have decreased sensitivity to androgens. Inheritance is believed to be polygenic, and it has been noticed more often in males with a family history of hypospadias. Recent studies have also suggested that in utero exposure to estrogens found in pesticides used in fruits and vegetables, as well as in plastic linings, can have an anti-androgenic activity. The main pathophysiological event for the development of hypospadias is the anomalous or partial urethral closure in the first weeks of embryonal development. External genitalia development occurs in two phases. The first phase, which happens between the 5th and 8th weeks of gestation, is characterized by the formation of the primordial genitalia and the absence of hormonal stimulation. In this phase, the cloacal folds are formed from mesodermal cells that are aligned laterally to the cloacal membrane. These folds fuse anteriorly and form the structure called genital tubercle, and posteriorly they split into urogenital folds that surround the urogenital sinus and anal folds. The genital tubercle has three layers of cells: the lateral plate mesoderm, surface phase ectoderm, and endodermal urethral epithelium. The latter is the main signaling center for the development, differentiation, and outgrowth of the genital tubercle. The second phase, which is a hormone-dependent stage, is initiated with the differentiation of gonads into testes in males with chromosomes X and Y. The testosterone synthesized in the testes has two very important functions: genital tubercle elongation and the appearance of the urethral groove. The distal portion of the urethral groove, which is called the urethral plate, is defined laterally by the urethral folds and outspreads into the glans penis. The urethra is eventually formed Once the urethral folds are fused and the skin of the penis is formed from the outermost layer of ectodermal cells, which fuses into the ventral aspect of the phallus and forms the median raft. Any genetic disruption or alteration in the signaling pathways in the male externogenital development and urethral growth may develop different malformation which includes hypospadias. So there are different classifications of hypospadias and it's according to the location of the abnormal urethral meatus. So one of the most commonly used classification is as follows. First is the anterior, which consists of the subcoronal and glandular. Second is the middle, which is the distal penile, proximal penile, and midshaft. Third is the posterior, which consists of the scrotal, penoscrotal, and perineal. In nearly 50% of cases, the location is anterior. 20% of cases have a middle location, and the rest are posterior. Overall, the subcoronal position is the most common abnormal location. Signs and symptoms of hypospadias may include opening of the urethra at a location other than the tip of the penis. Number 2, downward curve of the penis. 3, hooded appearance of the penis because only the top half of the penis is covered by foreskin. 3, abnormal spraying during urination of your infant. There are also a lot of risk factors for hypospadias, and this would include number 1, advanced maternal age. Number 2 is the pre-existing diabetes mellitus of the mother. 3 is the prematurity. 4 is the family history. And lastly, it's the environmental exposure. And that's all. Thank you.
Good day, I am Cristal Joy Pitao and I will be presenting the Hypospadias using Gordon's 11 functional health patterns. In health perception health management pattern, the patient has an older mother who has a diabetes during pregnancy. The father of the patient have a brother who were born with it. According to the mother, the patient has a low birth weight and born early. The father used tobacco products and the mother is exposed to pesticides through work. In nutritional metabolic pattern, family's typical daily food intake is lacking both fish and meat. They eat 3 times a day with vegetables. Their typical daily fluid intake is less than 2,000 ml each family member per day. The father drinks alcohol and the mother considers herself overweight. In elimination pattern, family's regular bowel elimination is normal and not have difficulty pooping at all. The client and his uncle have difficulty in voiding, have abnormal spraying of urine, and need to see to urinate. In activity exercise pattern, they do some physical activities like household chores, walking, playing board games, and playing within the house. They do not perform extraneous activities. In sleep rest pattern, sometimes they may be sleepy during the day and up at night, can perform daily activities and well rested. Did not use any aids to help them sleep. In cognitive perceptual pattern, they do not have any difficulty hearing and seeing others. Show social impairment. In self-perception, self-concept pattern, they feel embarrassed about or ashamed of their condition and sometimes feel lost hope. In roles relationship pattern, they live with their nuclear family structure, living together in one household. They also interact with others outside their house. In sexually reproductive pattern, difficulty performing sexual intercourse, sexual dysfunction, and infertility. Painful erection and problems with semen flow. In coping stress tolerance pattern, most helpful in talking things over are the father and it's frequently available. They did not use medications in coping stress. Lastly, in values beliefs pattern, religion is important in the family's life. This helps them when faced with difficult situations. They have plans for the future like have a good long-term outcome concerning sexual function and fertility, improving urinary elimination.
Hi, I am Marjorie An Padayao. I will be discussing on nursing care plan. Name of patient, Prince Arthur Navarro. Age 2 years old, 6 male. Address Giwanon Mabini, Bohol. Impression, the patient was diagnosed by Hypospadias assessment. Presence of dressing on one side. Diagnosis, risk for infection related to invasive procedure or catheter. Desired outcomes. The child will remain free from infections as evidenced by a clean and intact wound without redness, edema, odor, or drainage and negative urine culture. Nursing intervention. First, encourage to increase fluid intake according to age needs. Second, apply sterile technique during dressing changes, catheter care, or draining urine bags. Third, maintain the catheter and collection bag below the level of the bladder and a closed drainage system free of kinks in the tubing. Then maintain the catheter and collection bag marked in red. Fourth, reinforce dressing as needed and secure the catheter to the penis with dressing and tape and to the leg or abdomen with tape. Fifth, immobilize arms and legs with restraints, remove periodically, use a bed cradle following surgery. 6. Inform parents to avoid allowing the child to straddle toys, play in a sandbox, swim, or engage in rough activities until advised by the physician. 7. Teach the parents to sponge bath the child and use loose-fitting clothing, disallowing the contact of feces with the wand, and instruct in cleansing after each bowel elimination. 8. Educate the parents on the signs and symptoms of the infection. Rationally, promotes dilution of urine to prevent urinary infection, and after the catheter is removed will encourage voiding. Prevents contamination by introducing organisms into sterile wounds or cavities. Provide information that will enhance understanding of the defect to relieve anxiety. Promotes comfort and prevents infection and catheter displacement. Prevents accidental removal of catheter or contamination of wound if surgical correction is done for a more severe defect. Prevents trauma to or dislodging of catheter or infection. Promotes cleanliness and comfort without constriction. Provides information about the need to report immediately for early management. Provides knowledge and skill in caring and maintaining patency for catheter as the child may go home with a catheter or stent in place. Evaluation. The child will remain free from infection as evidenced by clean and intact wound without redness, edema, odor, or drainage and negative urine culture.
Good day everyone, I am Bevien Lyn Pepito and I am here to discuss the drug study related to hypospadias. So the treatment of hypospadias usually involves surgery to reposition the urethral opening. In this case, I am going to discuss the drugs that are given to the patient after the surgery. For pain control, the patient is given hydrocodone, and to improve the elasticity of the skin in the surgical site, the patient is given betamethasone ointment or cream. Let's start with betamethasone. It is an anti-inflammatory adrenal corticosteroid. Its dosage is 0.01% ointment or 0.05% cream and topical as a route. Its generic name is betamethasone valerate and brand names are Betaderm, Betaval, and others. The mechanism of betamethasone is a corticosteroid with primarily glucocorticoid activity. It induces phospholipase A2 inhibitory proteins or lipoproteins and sequentially inhibits the release of arachidonic acid, thereby depressing the formation, release, and activity of prostaglandins, histamines, and other endogenous inflammatory chemical mediators. Betamethasone topical use provides relief of inflammatory manifestations of corticosteroid-responsive dermatosis. This is used on the surgical site in order to increase blood flow to the penis, which improves the elasticity of the skin. It is contraindicated to patients with systemic fungal infections, acne vulgaris, acne rosacea, Cushing's syndrome, and periorbital dermatitis. The side effects of these drugs are blistering, burning, crusting, dryness or flaking of the skin, and irritation. The adverse effects are scaling, severe redness, soreness, or swelling of the skin. Moreover, here are the nursing responsibilities of betamethasone drug. First is to examine the area of infections and skin integrity before application. The patient's skin should be assessed to identify risk for problems such as pressure ulcers, skin tears, itch or scratch trauma, moisture lesions. Next is to apply the drugs sparingly. Do not cover with tight dressings. Overuse of any ointment, especially for long periods, can result in too much medicine being absorbed in the body. This may lead to thinning or weakening of the skin or other side effects. Lastly, is to report irritation or infection at the site of application. This is to have a necessary immediate intervention to the problem. Moving forward to the other drug, hydrocodone, it is a narcotic opiate agonist analgesic. Its dosage is 1.25 milligrams every 6 hours and PO as a round. Its generic name is hydrocodone bitartrate and brand names are Norco, Rodelyn A, and others. The mechanism of action of hydrocodone is an opioid receptor agonist and produces analgesic effects by affecting mu opioid receptors, CNS depressants with moderate to severe relief of pain. Hydrocodone is indicated for the management of moderate to moderately severe pain, sometimes in combination with acetaminophen or ibuprofen. It is contraindicated to patients with hypersensitivity to hydrocodone, acute or severe asthmatic bronchitis, COPD, and upper airway obstruction. Its side effects are unusual drowsiness, dullness, tiredness, weakness, or feelings of sluggishness. Its adverse effects are dry mouth, constipation, and extreme drowsiness. Furthermore, the nursing responsibilities for hydrocodone are to monitor the effectiveness of drug for pain relief. This is to make sure that the drug produces the desired result. Next is to teach the significant others or the family to avoid any hazardous activities until response to the drug is determined. This is to avoid accidents or undesired events to happen. Another nursing responsibilities is to allow the patient to drink plenty of liquids to solve dry mouth and constipation problems and avoid dehydration. Lastly, advise the significant others to not give larger doses than prescribed. The abuse potential of hydrocodone is high. This is to avoid overdosage. So, that is all the drug study for Hypospadias. Thank you. Hello everyone, I am here to share our overall evaluation regarding the Hypospadias case. Children who undergo hypospadias repair are usually discharged from the hospital the same day as the surgery. Health teaching towards home care and discharge instructions are essential parts to give our patients for immediate healing of the wound and for the patient to return to its normal living. First is to teach the significant others with the proper dressing. With regards to bathing, sponge bath the patient until the dressing is removed. The SO can give tub baths when the dressing falls off 2 days after the surgery. With reference to the diet, the patient can resume a normal diet at home. Encourage fluids, for example, ice pops, juice, or soup to keep his urine clean. Some children may have nausea or vomiting from the anesthesia, but most will be fine. Gradually, appetite will return to normal and he can have any food he likes. Encourage quiet play, like watching television, playing board games, or walking your infant in a stroller, or encourage. There is no need to restrict the activities of infants except for swimming and rigorous play until allowed by the physician. Continue the medication that the physician instructed. Have a follow-up care to check for the update of the recovery, to answer also the questions or problems that had arisen, and have his catheter removed about 1 week after the surgery unless instructed otherwise. So that ends our case presentation. I hope you have understand and gained knowledge on this case. Thank you and God bless.